Diabetes is a chronic health condition that occurs when the body is unable to properly regulate blood sugar levels. There are several different types of diabetes, each with its own set of causes and risk factors. Understanding the causes of diabetes and the factors that increase the risk of developing the condition can help you take steps to prevent or manage the condition. Type 1 diabetes is an autoimmune disease that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Insulin is a hormone that helps regulate blood sugar levels in the body. Without insulin, the body is unable to properly use and store glucose, leading to high blood sugar levels. The exact cause of type 1 diabetes is unknown, but it is believed to be a combination of genetic and environmental factors. Some of the risk factors for type 1 diabetes include 1. Family history of diabetes. 2. Being of non-Hispanic, white race. 3. Living in a colder climate. 4. Being exposed to certain viruses or other environmental factors. Type 2 diabetes is the most common form of diabetes and occurs when the body becomes resistant to insulin or is unable to produce enough insulin to regulate blood sugar levels. Type 2 diabetes is often associated with obesity and is more common in adults, although it can also occur in children. Some of the risk factors for type 2 diabetes include 1. Obesity or excess weight, particularly around the waist. 2. Inactivity or lack of physical activity. 3. Family history of diabetes. 4. Being of certain racial or ethnic groups, such as African Americans, Hispanics, Native Americans, and Asian Americans. 5. Having high blood pressure. 6. Having high cholesterol. 7. Having a history of gestational diabetes. 8. Having polycystic ovary syndrome, PCOS. 9. Having a history of prediabetes. Gestational diabetes is a type of diabetes that occurs during pregnancy and typically goes away after the baby is born. Gestational diabetes occurs when the body is unable to produce enough insulin to meet the increased demand during pregnancy. Some of the risk factors for gestational diabetes include 1. Being overweight or obese. 2. Having a family history of diabetes. 3. Being older than 25 years of age. 4. Having a history of gestational diabetes. 5. Having a history of delivering a large baby. 6. Having a history of stillbirth or neonatal death. 7. Having a history of high blood pressure or preeclampsia during pregnancy. 8. Being of certain racial or ethnic groups, such as African Americans, Hispanics, Native Americans, and Asian Americans. Prediabetes is a condition in which blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Prediabetes is often a precursor to type 2 diabetes and can increase the risk of developing the condition. Some of the risk factors for prediabetes include